June is Alzheimer's Awareness Month, and while there's still no cure, doctors say the fight against the disease is entering a new chapter.
New tools are changing how Alzheimer's is diagnosed and treated, just as summer heat brings added health risks for older adults. Kylie Hill has the story.
It's a disease with no cure and a diagnosis that changes everything.
Family members will usually bring the patients to clinics saying that they're struggling to do things that they're usually pretty good at doing, like routine tasks.
Alzheimer's is the most common form of dementia, affecting more than 6 million Americans. The average age of diagnosis is around 75, and doctors say during the summer months, extreme heat can pose additional risks for older adults.
It's just one of those things you look at where the patients are getting dehydrated and they're staying up with the fluid after. We know our elderly patients may be more sensitive to things like heat and being able to keep up with fluid intake.
While there's still no cure, doctors say we're entering a new era of understanding and treatment.
In the past, patients used to present with family members concerned about memory, and patients got a diagnosis of Alzheimer's disease. So we are becoming more specific now. We're becoming more sensitive, where we have what we call biomarkers. Right, we can actually test for evidence of Alzheimer's disease instead of just using clinical history or patient family reports.
In recent years, the FDA has also approved new medications aimed at treating the cause of the disease, not just the symptoms.
These are medications that can actually affect the progression of the disease, and we call them amyloid clearing drugs. They can take out these proteins from circulation and prevent the breakdown of the neurons, as we see in Alzheimer's disease.
Doctors say as research advances, so does the potential to slow or even prevent Alzheimer's before symptoms ever begin.
We can be able to test patients for some of these biomarkers, and if they're positive, we can put them on a treatment plan to prevent development of Alzheimer's disease symptoms. In fact, there's some clinical trials now that are looking at this, where patients who are not having any symptoms but have positive markers are going on drugs and then being able to evaluate years later and say, compared to people who did not go on the trial drug, their memory has remained pretty intact.
Kylie Hill, Fox 56 News.